say, right, okay, I'll see where we are now. It's coming. It takes me a minute or two to wind itself up, but it'll get there. And that's when I realized that everybody actually realized that we're already here. So give us a second.
Oh, it's telling me I'm getting a message.
Yep. Meeting is now streaming live on Facebook. We are officially there, Tim. Right. Wow. Good evening, everyone, and welcome to Talking Tea Thursday. Now, just for a nice change, we have a really, really exciting visitor this evening. And our guest is Tim Ives. Now, Tim is a dental hygienist of nearly as many years as I've been in the dental profession, but not quite. International speaker, he's a teacher, he's a fellow of the Higher Education Academy with an MA in medical education. His main areas of interest these days are breathing, oral myology, which he will explain what that is, online education, teaching, mentoring, action research, sugar, a real interest in sugar, which is something we think we know about, but we don't, and of course, oral health. So in 2017, Tim qualified as a vertigo breathing practitioner, and he has co-authored a book called Lip Zip. Now, if you read our blog post of last week, and we've let it run for a couple of weeks, and we've sort of sent reminders out, go and read it, because it will explain a lot more about how our breathing actually affects our lives. And obviously from Growing Smiles' point of view, we're always interested in the aspect of oral health, but it's so much more than that. We think we know how to breathe because we sort of do it naturally, but Tim is going to educate us a little bit more, actually probably a lot more, so that we're much better equipped to breathe better, to live better, and improve our overall health and well-being. So now then, I'm going to switch that. There we go. And have side-by-side moments here, Tim. So anyway, Tim, can I, first of all, welcome to Talking Tea Thursday. Welcome to Growing Smiles. And I'm really genuinely pleased that you agreed to do this. So, you know, can you really start us off by explaining a little bit about breathing through your nose, breathing through your mouth, and really, does it really matter? You know, is it such a big deal?
Well, thank you, Leigh, for inviting me on your show. It's a great question, and the short answer is yes. On a really basic level, we have a nose on our face, and it's there for a reason, and it's there to breathe through, and that's primarily because of our sense of smell. So if we kind of miss out our nose, then we're missing out on life's rich tapestry, and we simply can't smell the roses. And our sense of smell is also fundamentally linked to our taste, as you know. So without our smell, we can't taste food. And that it has an evolutionary aspect as a safety mechanism, so that we can smell when something's not quite right. So potentially that's there to save our life, and that's how that's evolved.
Wow.
So that's the kind of very basic sort of why we have a nose. So running alongside that, it's a filtration system, and it filters out between 98 to 99% of any particle that goes into your nose. So that's pollutants, unhealthy bacteria, viruses, anything else that you don't want ending up in your body. Your nose is very effective at kind of filtering that out. So that's really, really key. And so if we don't breathe through our nose and we breathe directly through our mouth, then all of that stuff that you don't want in your body ends up in your lungs. So that's really, really a really key point. Now, your nose has got a turnaround time of, it's very quick. It's like just about 30 minutes. Anything that kind of goes in gets washed out pretty quickly through the mucus within your nose and the cilia that hang around your nose. They filter everything out. Anything that goes into your lungs can stay there up to about 120 to 200 days. Kind of think about
that's a long time.
That's a long time. And if you're somebody that's kind of prone to allergies or asthma, then, and you keep breathing through your mouth, then eventually your body is going to start attacking things that it doesn't really need to. And that's when people start to get these allergic reactions to things.
So that's why people start to sniffle and sort of have a drippy nose and constantly sort of sneeze when you don't think you should be sneezing because you don't have a cold.
That's right. There's another one, there's one more, well, there's two more other key points about the difference between nose and mouth. The other is that the volume that you breathe in through your mouth is about 10 to 15 litres per minute. And if you're a nose breather, that's 4 to 6 litres per minute. So the volume difference is enormous, and that can have a huge bearing on other things that we'll probably come on to later, but also just to how much energy you have and how you behave as a human being. Because if you can imagine that you're breathing 4 to 6 litres of air per minute, you're going to be pretty calm and laid back. But if you're breathing 10 to 15 litres per minute, that's kind of like running for a bus territory. That's where you're permanently on overdrive. So you can imagine the effect that that has on people who are breathing like that all of the time.
Yeah, yeah. And we all know
sorry, go on.
We all know people that constantly seem to be going. And so many people don't realize that there's a difference between breathing through your mouth and through your nose. I mean, how can we actually tell if we mouth breathe, Tim? I mean, are there signs and symptoms? You know, what do we need to look for? Do we just need to go?
Well, obviously you can pick it up. Sometimes it's pretty obvious. But you're quite right. There are people who can hide it well, and there are people who do both. They mouth breathe and they nose breathe, and that's much more difficult to observe. But if your listeners and your viewers have got a pen handy, this might be a good time to grab one, because I'll fire some things at you that might be signs and symptoms of mouth breathing. So nasal congestion, runny nose, asthma, dry cough, sleep disturbances, fatigue, ADHD,
Wow,
tongue thrust, altered speech patterns, bedwetting, allergies, enlarged tonsils, tonsil stones, bad breath, snoring, sleep apnea, low energy levels, crooked teeth, recessive chin, bloating, chewing with your mouth open, tongue tie, gum disease, overuse of chapsticks, chronic fatigue syndrome, daytime sleepiness, the list goes on.
Really? Gosh, that's quite overwhelming, the amount of things that can do that. Tell me a wee bit about how the speech patterns are altered, Tim. That's something I haven't heard before.
Well, it's a sign. Well, I'll just go back and just say that if you've got some of those things, doesn't necessarily mean you're a mouth breather. It means you're more prone to mouth breathing. But there's some key things that you definitely are a mouth breather, and that would be asthma, usually allergies, snoring, sleep apnea, they're all a given that you're a mouth breather. So going back to your question, is that I can't remember what it was.
About the speech.
Yeah, I mean, there's many people that are mouth breathers because they've got an undiagnosed tongue tie. And if they have a tongue tie, then they will find it very difficult to speak normally. And they usually, people who have gone on throughout their life without it ever being picked up, then those sorts of people have to adjust their speech. And you would pick them up and have sounding not quite as you would expect them to sound.
Right. And I mean, if you had a child that was a mouth breather, what sort of things would you look for to sort of, or would you be suspicious that they're a mouth breather because of behavioural change? You mentioned ADHD there.
Sure, yeah. It's there's been lots of research, mostly in America, where they've looked at pediatricians, and they've asked them if they can identify the differences between sleep disorder, sleep disordered breathing, and ADHD. The symptoms are very similar, and 1 out of 6 could identify that. 5 out of 6 couldn't. So the majority of specialists that children would be going to for a diagnosis of ADHD could be incorrectly diagnosed either way. So there are a lot of mouth breathing children who have been misdiagnosed as having ADHD and then going down the route of being medicated incorrectly. The medication that is given to those children is typically Ritalin. You might be familiar with that. Yeah. Billions and billions of doses of Ritalin have gone out. And that would be the worst thing to give somebody who had sleep disordered breathing. So there really needs to be a big overhaul with the research and the information that is going out about the differences between those two.
Yeah. So from a parent's point of view, is there something in particular they can look for and as far as how to sort of recognises their child's mouth breathing?
Well, first of all, observe your child. Have they got their mouth open during the day? Are they snoring at night? And if they're snoring at night, then that needs to be addressed. Yeah. Because children should not snore. It's not a natural thing to do. Mm. The younger the child, the easier it is to resolve. If they're a small baby, then it's very easy to resolve. And obviously, the older the child gets, the more difficult it becomes to readjust that behaviour.
Yes, because obviously then when you have to try and work with them to get them to sort of keep their mouths closed and do those sorts of things. Fascinating stuff. In your blog post, if I can just move on a little bit, in your blog post, you talk a lot about the relationship between mouth breathing and COVID-19 infection. Can you just go over that a little bit? Because I mean, there'll be some people who will tune into this either now live or they'll come back to it and they maybe not have read the blog post. If you haven't read the blog post, folks, you can find it on the website under Healthy Tips and Blogs. But Tim might just give us a little sort of summary of what you were talking about that.
Okay, well, going back to what I was saying before, our nose filters out viruses extremely effectively. And so that's your first line of defense against any virus. And if you're breathing through your nose and you're breathing very small volumes of air, so 6 litres compared to 15 litres is a huge difference. So your volume intake, if there's a virus present in the atmosphere that you happen to be in, or somebody sneezes at you and you're breathing in through your nose, then first of all, you've got this line of defense where 99% is going to get trapped, but also the volume is low. So you've got this kind of double line of defense there. So somebody who's breathing through their mouth hasn't got that filtration. The virus is then going to go straight into their lungs in high volumes. But there's another really key thing, and there's this magic molecule called nitric oxide. It's not nitrous oxide, which is laughing gas. It's nitric oxide. And that was discovered...
Get over that and think you're onto something there, isn't it?
Yeah, that'd be great, wouldn't it? If we had nitrous oxide being released in our nose, we'd all be happy. So no, it's kind of magic molecule, really. It was discovered not so long ago. And the team that discovered it actually won the Nobel Prize. And it's they're still researching it now. But what we know is it's a gas that appears in our sinus cavity. And it's toxic to viruses. So, and if you stop breathing, and if you're a smoker, then you're, if you stop breathing through your mouth, so if you stop breathing through your nose and start breathing through your mouth, or you're a smoker, then you have less levels of nitric oxide. So nose breathing effectively ensures that you have a good supply of nitric oxide. That is toxic to any virus. That also goes down into your lungs. The gas goes into your lungs, and it acts as an antiseptic in your lungs. It goes through the alveoli into your blood, and then it kind of disappears. And that's where they're kind of like still looking to see what happens. But it's a bit of a magic molecule. So you've got three things that are going to protect you against COVID-19: your filtration, the volume that you breathe, and nitric oxide.
Yeah, so we've got sort of like a first line of defense without even having to put a mask on.
Exactly. And one of the issues of wearing a face mask is it can, in some circumstances, encourage people to breathe through their mouth when they're wearing a mask.
Now, why is that? Why would you? I suppose we're used to masks, maybe, but I mean, why would people? Is there something that just automatically makes you breathe more likely through your mouth when you have a mask on?
Yes, there are some people that are more sensitive to carbon dioxide, and carbon dioxide might pool in your face mask, and carbon dioxide might make you feel like you need to breathe more.
Right.
And with those people, they might start breathing through their mouth instead of their nose.
Yes.
But your nose is probably more effective than your face mask. So breathing through your nose is probably more important than wearing a face mask.
So do you think really the government should have been telling us all just to zip our lips together and breathe through our nose and don't worry too much about the masks? But there's another good reason for having masks on as well, isn't there? Exactly.
I mean, the best thing to do is to breathe through your nose and wear a face mask.
Yes.
Wear a face mask effectively, pinched on your nose, under your chin, and tight at the sides. Don't touch it when you've got it on. Make sure you wash your hands before you put it on and when you take it off. If you kind of follow those kind of guidelines, then you really are protecting yourself against COVID-19.
Certainly doing as much as you absolutely can, but how often do we see people, you know, they put the mask on and then they've pulled down or they've pushed it up, and yeah, it's but those two things are great to know, actually, to breathe, put your mask on properly, breathe through your nose, and then you've got that double gain, or literally you're doing as much as you physically can to protect yourself and other people, of course.
There's a couple of other key things. The two times when people are most likely not to follow that are when they're talking. It's very easy to breathe through your mouth when you're talking. And secondly, when you're sleeping, because you're not in control of yourself fully when you're sleeping. So they're the most common times to kind of like where you're more likely to falter. Right.
Is when you're talking, when you're sleeping. Well, hopefully when you're sleeping, you're not putting anybody else at risk. At least that's something. You talk about rinsing your nose out as well, about clearing your nasal cavity, and washing your nose out being just as important as washing your hands as far as protecting yourself and others with from COVID-19. Tell me a wee bit more about that, please.
Well, if you think about it, first of all, the virus itself is much more likely to start developing in your nose. We know from research from the University of Carolina that the receptors that the virus needs are more abundant in the cells inside your nose than they are anywhere else on your body. Now, if you wash your hands, the reason you wash your hands is so if you do touch your face, then you're less likely to pass on the virus to yourself. When people touch their face, they're much more likely to touch their mouth than they are their nose, aren't they?
That's right, yeah.
Yeah.
And we do it subconsciously, don't we?
And there's less chance of you, there's a greater chance of you passing that virus on through your nose than there is your mouth, because the virus likes the cells inside your nose. That's really, really key. The further you go back down the respiratory system, the less of these receptors the virus can find. So what we know from research is that the coronavirus will start in your nose, that's for sure. So if you're doing all the right things, you're breathing through your nose, and you're wearing a face mask, and then on top of that, you are trying to clean out your nose as well, like you do your hands, then you're going to, it's like an added bonus, you're going to try and wash things out from your nose. Now, I personally are a huge proponent of spraying my nose to keep it clean. When during clinical practice, I would be doing that 3 times a day. Nowadays, twice a day, morning and night, but lunchtime if I'm seeing patients. So and that would apply if you're kind of like on the underground on a bus. You probably want to do it more often.
Anywhere that you're basically going to be in contact or exposed, potentially exposed.
That's right. So you've got greater virus. There's a greater risk of viruses being present. Now, the company Clear in America have been making nasal sprays for 20 years, and they're the ones that I've been using. And it's the one that I've particularly been using is the one that they first developed. Oh, you've got one. Aha! Oh, you've been using it as well.
Best Blue Peter fashion. As they always say, hold on, I'm large. Best Blue Peter fashion one I made earlier, you know. Yeah, I have to say, I find because I would get a bit sinusy at times, I would spray my nose. But since I was talking to you, I thought I must try this. So yeah, I've been using it. So anyway, I interrupted. Fire on.
Thanks for waving that. I would just tell anybody watching, that one there is designed for adults. Yeah, and the best way to use that is to obviously take the cap off and put it up your nose and then squirt. But don't block one nostril when you do that. Keep both nostrils open, and then the other side. And when you do that, well, first of all, blow your nose, then do what you've just done. But when you're doing that, look at your toes. So bend your head right down.
Right.
And that makes more of an easy passageway for the spray to get to where it needs to get to.
That is a great tip, because I mean, I think your automatic reaction is always to tip your head slightly back with a sinus rinse. I mean, I would use a saline sinus rinse before I sort of came across this. But yeah, I never thought of looking down. Makes sense though.
Look at your nose to squirt your nose. Look at your toes to squirt your nose.
I was going to wonder how I was going to do that.
Yeah.
I could have been quite an interesting, quirky shape, that. But yeah, no, that's really. And what is it in the X? I mean, this is X-Clear, which is obviously they make a lot of xylitol products, and anybody that follows Growing Smiles knows that we're big fans of xylitol. So, I mean, is it the xylitol in this that adds the?
I'll tell you the story. This one came about from a doctor in America who had a granddaughter that kept getting ear infections, and a baby. She was a baby, and from the research at the time, they knew that chewing xylitol chewing gum not only prevented tooth decay, but it had a real positive side effect of also preventing middle ear infections. That information and that research is now in Cochrane. So
it's been there a while, hasn't it?
That's gold standard research. And so he thought, well, I can't give my granddaughter chewing gum. So he developed that nasal spray that you've got there. So his daughter could squirt that up his granddaughter's nose every nappy change. They did it every nappy change. And no more ear infections. So that's when they started to produce the nasal spray. And all that's got in it, as you quite rightly said, Leigh, is the xylitol a little bit of saline, a little bit of salt, and as a kind of preservative, grapefruit seed extract.
Yeah.
So the story goes that during COVID-19, Clear thought, well, why don't we see if any of our nasal sprays are actually effective against the virus? So they approached two universities, Utah State University in America and the University of Geneva in Switzerland, to have a look at the potential for the virus being destroyed by the nasal sprays. And surprise, surprise, they were. I've actually got the lab results here, and you have to take my word for it because it's not been published yet.
Wow.
But this nasal spray destroys the coronavirus.
You heard it here first, folks. Yeah. Grapefruit seed extract. That really almost quite surreal, isn't it? When you look at all the research that's going on worldwide on COVID, to find that something that seems almost, too easy or too simple.
What's really, really interesting, what I found personally interesting, I mean, the two really kind of active ingredients in there are really the xylitol and the saline, but it's actually the grapefruit seed extract that's destroying the virus.
That's really impressive. So, I mean, I would say, I know, as you know, I've been a big fan of xylitol for years, and I sort of assumed, because of the impact on middle ears and the ENT sort of aspect of it, that it had to be something to do with that. But I mean, the grapefruit seed extract is really, it's slightly unusual, but great to know that there is that added benefit to that.
What they're doing now is there's human trials underway at a university hospital in Florida,
right,
on that particular nasal spray.
Well, we'll watch that with interest, won't we? Yeah, and see what comes from that, because we could all be, not only will be getting a vaccine, we'll all be looking to get the nasal spray on a regular basis as well. And it just, I mean, as things are sort of seem to be tightening up again right across the UK, I think we all need to take responsibility for our own health. I mean, a Growing Smiles is all about getting people to help themselves to improve their oral health. I mean, what impact does breathing through your mouth or your nose have to do with your oral health?
Wow, what a great question. So, I mean, so we know gum disease is a kind of two-way disease, don't we? So oral bacteria cause oral inflammation, but systemic inflammation also causes oral inflammation. Yeah, and that makes it easier for unhealthy bacteria to thrive under the gums.
So basically, inflammation in any part of our body can affect any other part of our body, given the opportunity.
Sure. So, I mean, before we went live, we were talking about sugar, weren't we?
We were.
And I mean, sugar is probably one of the biggest inflammatory foods on the planet. And it's the one that we consume most. And the extreme end of that is that in America, there's 35 million people dying every year from diabetes. In UK, it's 75,000 people die every year. And that's the same figure as smoking on its own.
Wow.
So sugar is killing us. And it's also creating a lot of inflammation within our body. So what's this got to do with oral health and COVID-19? So when we don't clean our teeth and we eat too much sugar, then the body releases cytokines. And cytokines are proteins that coordinate the body's response against infection and trigger inflammation. So too many of these cytokines can trigger the immune system to start attacking itself. And that's essentially what happens when a really bad inflammation. So COVID-19 is producing a cytokine storm. So to attack our own, so our immune system starts attacking itself. If we already have lots of inflammation in our bodies, then we've got a big problem if we encounter the coronavirus. So really there's a big kind of connection between oral inflammatory diseases like gum disease and COVID-19 through the inflammatory process within our bodies.
Yeah, and of course we know that those people who are ventilated, that there's an increased risk of inhalation pneumonia. And we've had this discussion in Growing Smiles before about, you know, it's not that the COVID-19 does that, it's the fact that the inflammatory response allows those bacteria that are opportunistic to then be inhaled and aggravate the situation. I think it's worth sort of mentioning that one of the things that actually Chief Dental Officer in England did when the Nightingale hospitals, they were redeploying dental staff to actually provide mouse care for that reason, to actually try and reduce really bad outcomes if you were ventilated. So having your mouth healthy, folks, to start with, does help your long-term outcomes from avoiding too many serious complications from COVID-19, which has got to be a good thing. So there's another good reason for remembering to brush your teeth at night. But there's other things that can be impacted if you're breathing through your mouth. I mean, from an oral health point of view, Tim, isn't there?
Well, I mean, if you kind of go back to the very beginning, our breathing affects our development of our face. So our tongue position determines how our face is going to structure as it grows. Our tongue acts as an orthodontic appliance. So if you're breathing through your nose, then your tongue is up and it's pushing your palate out this way.
I'm just becoming really conscious of where my tongue is now.
Yeah. If your tongue is in the middle of your mouth or it's down, then you're a mouth breather. And you do not get this structural development that you should have if you're a nose breather. So on a really kind of long-term basis, from a child up to an adult, as they're growing, your breathing affects your development. It also affects the size of your airway. So that the wider palate you have and the more further forward your jaw is, the bigger your airway is. The opposite. So if you're a mouth breather growing up, then everything goes back and restricts your airway with a small airway, and the likelihood is you have small thyroid development as well. So there's that side. Then there's the obvious side that if you are a mouth breather, then you're breathing in through your mouth. You're going to dry out all of your tissues inside of your mouth. Kind of like, you kind of imagine the difference between an environment that's like a desert or an environment that's like a cave. They're completely two different environments. And that would be the change in your mouth if you was breathing through your mouth or your nose. Your mouth likes to be moist.
Yeah, it does.
And if it's moist, you have that saliva protecting everything. If it's dry, then you're going to be far more prone to tooth decay, and you're going to be far more prone to gum disease, the two biggest diseases that we have to deal with.
Yeah, both of which are preventable.
Exactly.
And I think you were talking about diabetes earlier and how sugar was killing us. I mean, you know, the cost and health service of non-communicable chronic diseases worldwide has got to be phenomenal, and tooth decay and gum disease are right up there. And funny, we're going to touch base again on this in a couple of weeks' time in Talking Teeth Thursday. I had a medic, a GP, who sent me a copy of a request that he had from hospital for a child to have a general anaesthetic for extraction. And he says, how does this happen anymore? And, you know, you have to sort of then explain, you know, just how common tooth decay is. And I suppose for those children that are mouth breathing, their mouth is constantly dry and they have that high sugar grazing type diet, whether it be food or drink, you know, more often it's in there, the longer the sugar's in contact with the teeth, the more likely you're going to have a cavity develop. And likewise, I think when your mouth is dry, the biofilm, the plaque biofilm, tends to be more tenacious, doesn't it? It tends to be more difficult to remove.
Sure.
And also there's the fresh breath issue that we're not very good about talking about, do we? It's what your best friend won't tell you. And we're all going.
I think, Leigh, this might be a good opportunity to remind your viewers that aren't dental people what sugar is. Because we were saying, like, people are so confused nowadays about, because there's about 60 different names for sugar now, isn't there?
Absolutely. Oh, please do, because I think it's, there was a really nice post that it's somewhere back on our Facebook post, which I think it was the British Heart Foundation made a really nice infographic about sugars and all the things that actually were sugar that were going to add calories, add weight, add your risk of tooth decay. So please give us a quick summary of, you know, how do you recognize sugars when you buy things in the shop and you look at ingredients labels? What should we be looking at?
Well, the first thing to bear in mind, Leigh, is that the sugar industry is powerful, and they will do everything they possibly can to A, make you eat sugar, and B, keep your addiction going. The sugar is not a food, sugar is a drug. Anybody that believes sugar is a food are wrong, because it has no health benefits. We do not need it in our life. We're much healthier when we don't have it. So that's the first thing. You've got to want to read labels. Do not believe that supermarkets have your best interests at heart, because that's simply not the case. They want you to buy products, and become familiar with what the different terms of sugar. So usually, most of the time, it'll end in OSE. If there's an OSE, then it's a sugar. And actually, I mean, I hate to say this, the most dangerous sugar actually comes from fruit, because fructose is the most potentially damaging sugar to a human being, because it's the one sugar that will get stored and converted into fat. So sucrose, the most common sugar, is half glucose and half fructose. So glucose is used as an energy source, can't be stored. Fructose can be stored and converted to fat. So sugar will make you fat and obese, and it will make you put on weight, as well as creating diabetes, heart disease, obesity, tooth decay.
So fructose, explain the difference between fructose and, I mean, we talk about free sugars and sugars that have been added through processing or manufacture, or we put it on our cornflakes or whatever you do with it, and the sugars that are actually found in whole natural fruit. And I'm thinking of fructose in relation to an apple or another piece of fruit, you know, and the potential damage, because I think a lot of people get really confused with that. Oh, you know, saying don't eat fructose, but you're telling me to eat fruit.
It's really, really, really confusing, and I completely understand how the public are just tearing their hair out saying what is healthy, because one minute you're telling us this is healthy and now you're telling us it's not. And I think the key thing to remember with fruit is that when you eat a piece of fruit, the amount of sugar that you're eating is tiny, and your body has to break it down to get to that sugar, so it's not immediately available. So an apple is healthy. There's a tiny amount of sugar in there, and the gain you get from that is much, much, much better than the loss you get from the sugar. But when you extract that sugar out of the apple, convert it into fructose, so it's pure sugar, then that is really, really bad. I think that's the best way to explain it. The other thing that is not good is squeezing fruit and actually taking it down to a liquid form, because that really is making it easier for your body then to get to the sugars. So the best way is to eat fruit in its form that you buy it in, fresh fruit.
Fresh
But
fruit.
what I really like in the UK, we say 5 fruit and veg a day.
Mm-hmm.
In Australia, they're now saying 7 a day, 5 vegetables, 2 fruit.
Right.
So they're trying to move people more away to fresh vegetables and less fruit.
Yeah. I think is so important that because we tell parents to sort of because children, the way sort of you've got baby-led weaning, for instance, and you're meant to be giving your children food when they want it type thing. It's knowing what is that snack meant to be, and oh my gosh, should I be giving them fruit? And dried fruit is a big issue, isn't it? We have a big issue with dried fruit. So and again, it's back to that condensing the sugar when you take the water out aspect of fruit, that then all of a sudden becomes a sticky, gooey mess that's there and in contact with the teeth for much longer, isn't it?
Yeah.
By the way, I just have to throw this in here, Tim. Now, just don't let your head get too big because you can read it later. I'm learning, we've got a really nice comment here from Jerry Helen. She says, I'm learning loads. Please tell Tim, let Tim know he is awesome. So cool. Big thank you. There you are. You're really cool. There's one for brownie points with the family there, Tim.
Yeah, I'm now blushing. Thank you.
Not often you see Tim Ives blush, that's for sure.
No.
No, I mean, it's great. So listen, so I think we've talked about a whole lot of things. We've talked about breathing. We've talked about whether you breathe through your nose, breathe through your mouth. We've talked about sugars. We've talked about gum disease. So, what is your top tips for oral health? What would you sort of say you're sort of the best things we can do for breathing and for a healthy smile for all our lives?
I would say number one would be don't consume so much sugar. Don't eat cakes, sweets, and drinks containing sugar. Because I think when you kind of think of it logically, overall, that's the thing that really has the most potential to do you some damage to your health. As far as teeth cleaning goes, I mean, the national recommendation of brushing your teeth twice a day, 2 minutes, toothpaste containing fluoride. I personally also like xylitol in there as well, because xylitol has a benefit in additionally to destroy bacteria in a nice way. It destroys bacteria without bacteria knowing that it's under attack. So
like a stealth weapon for tooth decay, isn't it?
Yeah, it is. And you can have it every day, no side effects, and bacteria are never going to mutate. And they're never going to become nasty when you put xylitol in your mouth, which is quite nice to know. My favorite, obviously, is Spry. They do great xylitol toothpastes. I would say walk at least 30 minutes every day. Really important that we move as human beings.
Very, very sedentary, aren't we?
Yeah. And that's part of oral health, general health message. And as far as breathing, the 3 key things are your tongue up, your tongue position, your lips together, and your teeth apart. So tongue up, lips together, teeth apart.
Have you any little exercises that we could do to sort of improve our nasal breathing?
Honestly, that with nasal breathing, less is more. So the less you breathe, the healthier you are.
That's actually
the more you breathe, the unhealthier you are. If you think about the most healthy people that you know, you don't notice their breathing.
True.
And you would think they hardly breathe. Well, that's the truth. If you think about people who are really sick, who are dying, then they breathe a lot. And that's a good marker for health. So the less you breathe, the healthier you are. The more you breathe, the less healthy you are.
Quality over quantity.
Pardon?
Quality over quantity.
Yeah, so less. I mean, Have we got time to quickly talk about?
Yeah, we can go on as long as we like. A minute.
Okay, so
make yourself comfortable there.
let me just have some water. I'm getting a dry mouth. I'm talking
Cheers, Tim. We'll have a drink.
So if I said to you carbon dioxide, and all of your viewers and listeners, their first thought is that's a dangerous gas, and that's probably a waste gas. But carbon dioxide is really important for human being survival. And so we don't breathe to taking oxygen. We breathe to regulate our oxygen carbon dioxide levels. So if you were to measure your oxygen concentration, it would be the same as mine, as it would be anybody. What's different is the way we get to that point in time. So our brain measures the pH of our blood. So it's looking to see how acidic our blood is all the time. When it gets to a certain point, when it gets to a certain acidity, so when the carbon dioxide level gets to a certain point, it tells us to breathe. So that's how we breathe. It's a fail-safe mechanism. It could never go wrong. So we've evolved amazingly when you think about it.
Yeah.
Now, the hemoglobin is this little molecule that carries oxygen around our bodies, and its job is to deliver oxygen to where it's needed. So that might be our brain, or our muscles, or our heart. Now, what determines whether the hemoglobin releases oxygen to your brain is the acidity of your blood and how much carbon dioxide is in your blood. The more CO2 you have in your blood, the easier hemoglobin releases oxygen. The less CO2 you have, the tighter hemoglobin holds on to the oxygen. So the less you breathe, the more CO2 you have. And so the easier it is for hemoglobin to let go of oxygen into your body where it needs to be. The more you breathe, the more oxygen you have. So the harder it is for hemoglobin to be released. So there's a catch-22 going on there. Can you see that?
Yeah. The
more you breathe, the harder it is for hemoglobin to release. So have you ever encountered somebody who's having a panic attack?
Yeah.
And you know to put a paper bag over their face? Well, that's to increase the CO2 levels so that hemoglobin can get to where it needs to be. And
it's also one of the things that athletes have, isn't it? The fact that they're always encouraged to breathe through their mouth or to breathe through their nose, isn't it? That is I'm getting a whole education. Yeah.
So the best thing to do, going back to answer your original question, is to focus on breathing really slowly. If you're breathing slowly, then your airways are going to open up. You won't need to do any exercises because you only need a very small volume of air going in and out at a very slow rate. So, and if you think about it as well from the nitric oxide production, you've got a nice flow of air going in and out. You've got a nice nitric oxide production. The other thing that nitric oxide does, as well as being antiseptic, it's also anti-inflammatory. So it opens up the airways. So providing we do everything correctly, we work quite well.
Yeah, the body is an absolutely phenomenal piece of machinery, isn't it? You know, it really, it does all interact. I mean, I'm renowned for saying you can't chop your head off and think your head's not part of the rest of your body, and that it doesn't, one thing doesn't affect the other. It does, and it's so important that we think of our oral health in the terms of overall health. And I know some people have said, sort of, well, where's breathing coming into oral health and growing smiles? But it is so integral to function. no matter, you know, what you're trying to achieve, if you're not breathing correctly, the quality of what's going in is going to have such an impact on the rest of our bodies and our overall health and well-being, doesn't it really?
Well, I had many patients who had gum disease that were not responding. When I became qualified in breathing, I suddenly started to spot the mouth breathers who had gum disease. And when I addressed the breathing and the gum disease, then I got much better results and the patients got a lot better. It's kind of like looking at the whole person. If there's an obvious problem there, the problem was the mouth breathing in the first place, you have to address that.
Yes, and isn't it funny how you come across people thinking there's one issue and actually it turns out it's something else, and you just can't treat the symptom. You've got to actually address the overall health and well-being to actually improve the patient's health. It's not just about, you know, fixing their gums. You can't just treat symptoms. You have to sort of look at that overall individual as what's best for that person. And it may be sometimes that you actually have to modify what you're planning to do, isn't it? You know, to address the thing that's going to have the biggest impact and the longest gain for that individual. That's brilliant.
It's stepping back. It's stepping back and looking at the person and understanding that person, how they operate as a person, and really kind of getting to know them. And then you can really start to make a difference with people rather than focus on this.
Yeah. And I think this is where it's going to be really interesting going forward with the COVID-19 situation and access to dental care, and so much more being done virtually or at a distance, you know, phone triage. It's that little bit more difficult to build that rapport. And I mean, I know we spend a lot of our time coaching like this, and I mean, we're all Zoom experts, aren't we now? Who knew what Zoom was 6 months ago? But you know, it is trying to sort of build that sort of rapport with people, so you actually can get to identify what are their risks for their oral and their overall health. But you know, this has been great. Obviously, I mean, Paul Rainey, great, thanks, Paul. So relevant in these current times. So yeah, we're getting some nice comments here, Tim. But is there anything else? I know. Tell us a little bit about LeighGS.
Well, my friend Trisha O'Hare in America, who I've known for a long time, we have both been speaking on different sides of the Atlantic to our professions on this topic. And kind of what we felt was that it wasn't getting to the general population. The information was getting to clinicians and maybe their families, and on some occasions their patients, but not enough. And so we kind of decided just to write a book based very much on our experiences with different types of people with different breathing issues. And we just wanted to make a really easy reading book, which also had the science in there as well, for people to kind of get an idea about what they can do and to resolve their issues and where they can go for those problems. And that kind of escalated. Now what we've found is that there are a lot of practices, especially in America, that are selling our book to their patients.
Brilliant.
And so we did last winter, we wrote an online course very much based around that as well, because some people prefer to do courses and some people prefer to read books.
Yeah. No, and that you can get it on, now let me get this right because I always get this muddled, it's LeighGS.com.
No, it's
I knew I was going to get that wrong. I always just Google it in the end. Actually, it's funny because I have it saved anyway, but because I downloaded your book. It was an e-reader way back when then, but yeah, go on. Give us the plug for the book then. Where can we find out more, Tim?
LeighGSbook.com. But
words in the wrong order.
If people go there, I've also written a book to bring attention about snoring in children. called
One about the goose.
The Boy Who Snored and the Goose That Honked. That's a free download for anybody that wants to grab that. And it's a very light-hearted story, just written up to bring about attention, so parents and children can open up a dialogue about snoring with kids, because that's something that's really important and really needs to be rectified at a really young age. Could save a whole host of issues later on in life.
Yeah, but absolutely brilliant, Tim. Thank you so much. So, right, folks, you need to go and look at Google letthezipbook.com. That's not easy to say. If not, I'll put all the links in underneath this anyway, so in the comments box, so you'll have them. Tim, thank you so much for joining us. It's been so informative. We've known each other for a long time, but you're one of those people that I have conversations with, and I always learn something new. And maybe you'll come back sometime and tell us how you've got on. I know you're doing some research on sugar, and I think that would be really interesting because, as you say, it's a total minefield. And I think so many people get caught up doing the wrong thing, thinking it's the right thing. And it's not their fault, they just don't know, because, as you say, labeling in particular is so confusing. But maybe you come back and join us another time, would you?
I'd love to. Thank you very much for inviting me. It's been a pleasure. And likewise, Leigh, I always get lots of information from you as well. And I'm really, you should be really proud of what you've achieved and what you're doing here. It's brilliant.
Oh, thank you. We plug away. I always say Growing Smiles was taking the aspect that people don't have time for in a clinical setting and making it accessible elsewhere. And it's funny because we've now sort of, the way the whole profession and healthcare has changed over the last 6 months, I think we need to make sure that we're all taking responsibility for our health and doing our little bit. And it's like what you were saying earlier on, if we all do those little bits about our breathing and our mask and our hand washing, we're not only going to help ourselves, but we're also going to allow the health service, the funds, to concentrate on the illnesses and the diseases that actually people don't have any control over. So yeah, it's been absolutely fantastic. Thank you so much for joining us. I will, don't worry, I will pass on any other questions that pops up over the next few while. And please keep in touch. And thank you all for joining us. If you haven't been here before, thank you very much for coming in and watching us on Growing Smiles. Thanks, Tim, for absolutely phenomenal area of expertise, which is so applicable at the minute. Follow our Facebook page, go and have a look at the other bits of social media, have a look at the website. And as Tim says, if you're looking for a xylitol toothpaste, we do have a couple, and we are looking at the spray stuff just as we speak. So anyway, listen, thanks ever so much, folks. Take care, and we will see you all soon.